In our NICU, we were the first in Monmouth County to be able to have a head cooling program to cool the baby's brain after an insult near term birth. Has been shown after many years of research to reduce the amount of brain injury. So we know that it creates a protective effect in terms of neurodevelopmental outcome. There are specific criteria that the baby has to meet to be able to be eligible for that treatment. So it's not something we want to do for everyone or for very minor concerns at birth. But we are fortunate to be able to have that here so that we do not have to move babies to another institution. The whole concept of cooling the brain and creating that neuroprotective effect is best done in the first hours of life. So the earlier the better. If we have to transport a baby to another hospital for that kind of treatment, which is what we were doing before, I guess, a year and a half ago, it takes time. You know, by the time you evaluate the baby, make the phone calls, get a transport set up, it's often 4 to 6 hours, and really the window of opportunity is less than 6 hours. So to be able to do it right away here on site and not separate a parent from a child in such a stressful situation is really a good benefit for the babies and the families. It's kind of remarkably easy in terms of the technology. It's a cooling blanket. We put the baby on that. We drop their core body temperature down to a very specific range. And the machine automatically regulates the cooling pad temperature to keep the temperature in the proper range. It still requires a lot of management in terms of nursing care and checking the temperature and making sure we don't over or undershoot. We do it for 72 hours, and then we do a gradual rewarming of the baby. But we have been quite pleased to be able to work with our OBs and all of our babies here and be able to offer that to them. Luckily, we don't need to use it all that often, but when you need it, it's nice to have it right there.